So our next topic is conscious choking in infants. So age group 0 to 12 months. With mild choking, because an infant's diaphragm has a lower muscle mass than other age groups, coughing may not be possible. So we might have to perform the skill as needed, okay? So the back blows are same as the ratios for other age groups. We're aiming for 5, followed by 5 chest thrusts. The landmark for the chest thrust is just below the nipple line. We're aiming for 5 of those, okay, 4 centimeters. So I'm going to show you what that looks like on this infant, okay? So put it there. This is my infant, and there's lots of people around. That's the situation. So I have automatic consent. Otherwise, I'd be asking parent or guardian that is present, okay? Infant's choking. So pick the baby up. Put the jaw. 1, 2, 3, 4, 5. Oh, please call 911. This baby is choking. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Okay. So again, the hand placement is just here between the nipples, just below the nipple line, aiming for about 4 centimeters in depth. Okay. Do make sure the head is lower than the body so the gravity helps push out the object, and do make sure your leg is bracing the infant for both back blows and the chest thrust, so that the back blows actually get the vibration needed to knock out the object. Okay? So everyone's gonna practice that. Once you finish practicing, we're gonna talk about some emphasis points here. So prevention, of course, is key. Cutting objects or food up into small, manageable pieces, making sure they're age appropriate. So, soft enough for the infant's age. Toys, small objects, balloons should be kept away from infants and small children, okay? After the object has come out, do make sure you seek medical attention. They should be taken to the hospital because of the amount of force that you did to the infant to attempt to dislodge that object, okay? If the infant loses consciousness, we're gonna lower them to the ground just like the adult while protecting their head and spine. We do activate EMS immediately if you haven't, sent someone already, just because this was a witnessed arrest, which means we call 911 ASAP, okay? And then we're gonna immediately begin CPR using the 2-finger technique. If you're alone, we're gonna do that 30 to 2. If you have a second rescuer that knows CPR, we can start with the 15 to 2, okay? Each time we look in the mouth, we're looking for the object that is causing the obstruction, okay? The priority is clearing the airway before the infant loses consciousness, because it is way easier to get it out when they're still conscious versus when they do lose consciousness, okay? If the infant does recover from this, do make sure you monitor their vital signs, which we talked about in an earlier topic, until EMS arrives to be able to assess the infant, okay? So I'm gonna show you conscious to unconscious choking, okay? So conscious choking, infant's choking. So 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Oh, the infant has lost responsiveness and consciousness, okay? So we're gonna activate EMS immediately. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 25, 26, 27, 28, 29, 30. It's gonna peek inside the mouth. I don't see it. Tilt the head all the way back, cover the mouth and nose, and air does not go in. Retilt, try again. Air does not go in, back to compressions. 1 and 2 and 3 and 4 and 5 and 6 and 7, 8, 9, 10, 11, 12, 30. Oh, there it is. You see the object, turn their head towards you, scoop it out, okay? Attempt a ventilation. It goes in, they go in. but the baby's not breathing on its own, so we're going to continue CPR at a ratio of 30 to 2 for one rescuer or 15 to 2 for two rescuer CPR.